Alberta Health Services. Healthy Albertans, healthy communities, together.
Good afternoon, everyone. I'm David Wyant, Chair of the Alberta Health Services Board, and I would like to welcome you to this AHS Public Board meeting. Thank you for taking the time to join us. To start, in the spirit of recognizing the harms of the past, promoting reconciliation and gratitude, and in keeping with the calls to action from the Truth and Reconciliation Commission, on behalf of the Board, I would like to take this opportunity to acknowledge that the work of Alberta Health Services takes place on historical and contemporary Indigenous lands, including the territories of Treaties 6, 7, and 8, and the homeland of the Métis. I would also like to acknowledge the 46 First Nations communities within what we call Alberta, as well as the Métis and Inuit peoples who form an important part of our healthcare system. Our board members are joining us from across the country, and we also acknowledge the Indigenous peoples' territories in which they live and work. We are grateful to those who have come before us and mindful of those who will follow us as we steward and protect these lands. It's a short agenda today, but an important one for the board and for all of AHS. We are participating by telephone conference today. When I ask for a vote on a motion, I will ask for those opposed or abstaining. For those who neither oppose nor abstain, I will take it that you are in favor of the motion. If there are none or a minority who either oppose or abstain, I will declare the motion carried. May I ask that someone move approval of the agenda that has been circulated?
Mr. Chair, it's Sherry Fountain. I so move.
Thank you, Sherry. Will someone second the motion?
I will, Mr. Chair. David Carpenter.
Thank you, David. Any further discussion? Any opposed or abstentions? The motion is carried. Based on the approved agenda, do any board members have a conflict of interest that they would like to declare at this time? Hearing none, we will move on. I will ask Heidi Overgaard, Chair of the Human Resources Committee, to present the motion.
Thank you, Mr. Chair. One of the roles of the Human Resources Committee of the Alberta Health Services Board is to consider, monitor, oversee, and make recommendations to the board related to matters including the selection, compensation, and succession planning for the President and CEO, currently Dr. Verna Yu. The current employment agreement, effective June 3rd, 2016, between AHS and Dr. Yu will expire at 4 p.m. on June 2nd, 2021, unless otherwise extended. The committee recommends that the board approve an extension to the current employment agreement with Dr. Yu for a period of 2 years from its current expiry on terms and conditions materially similar to those in the current agreement. Dr. Yu wishes to extend the employment agreement on the same basis. Accordingly, I move that 1, the Alberta Health Services Board approve the extension of the current employment agreement between Alberta Health Services and Dr. Verna Yu, which is to expire at 4 p.m. on June 2nd, 2021, for a period of 2 years from the expiry, on terms and conditions materially similar to those in the agreement, and 2, the Alberta Health Services Board authorize its board chair to execute and deliver such documents on behalf of the Alberta Health Services as may be required to complete the extension contemplated herein, including performance metrics as may be agreed upon with Dr. Verna Yu. Thank you.
Thank you, Heidi. Thank you, Heidi. Will someone second the motion?
This is Syed Zilki. I second the motion.
Thank you, Syed. Any further discussion? Any opposed or abstentions? Thank you. The motion is unanimously carried. I'm very pleased that Verna will continue to serve as the organization's president and CEO for 2 additional years. Over the past 5 years, she has done an excellent job of providing stability to AHS when it was needed the most, and has been extraordinarily supportive of those working in healthcare. She is tirelessly leading this organization through a global pandemic with grace and resilience. On behalf of the whole board, I would like to say thank you to Verna and offer our full support. We are grateful for Verna's contribution to Alberta Health Services and to all Albertans. I'd like to offer Verna an opportunity to say a few words, but first, one of our other board members, Tony Dagnoni, has asked to say a few words. Tony?
Well, Mr. Chairman, I think you've said it well, but let me add a couple of other comments. To me, today's motion that has been read out by Heidi and approved by the board, it speaks volumes to the leadership continuity within AHS. I know all too well that serving as a healthcare leader anywhere these days is a daunting responsibility in the face of the unscripted pandemic that we're all facing. However, serving as leader of the Alberta Health Services is doubly challenging, given its provincial role and the impact it has on the health of all Albertans. We are indeed grateful for the leadership, as you've said, David, offered by Verna and the entire management team, along with the 100,000 plus healthcare providers. I think it's important for the board to acknowledge what I would call the staff's fearless display of courage and resilience during the devastating pandemic that you referred to. To me, that kind of dedication is a reflection of strong leadership within the executive offices, and it's duly noted in the spirit of today's motion. Thank you, David.
Thank you, Tony. And I agree. We just can't say thank you enough to the extraordinary staff and physicians and leaders and frontline and Albertans indeed for the extraordinary work they're doing during this pandemic. And now over to Verna.
Thanks, David and Tony and board members. I'll keep this short, but I did want to take the opportunity to thank everyone working at Alberta Health Services and in the healthcare system at large. I've long said that I have one of the best jobs in healthcare, and that's because of the incredible commitment, compassion, and contributions of all the staff, physicians, volunteers, partners, and most of all, patients and families to advancing healthcare in Alberta. This past year has been challenging for all of us in healthcare, and I am not only grateful, but I'm also inspired by the tireless work of everyone and for the efforts of all Albertans to take care of one another during incredibly challenging circumstances. So I'm excited about the opportunity ahead. Again, I would like to thank the board for all their support, and to the teams here at AHS, I'm honored to continue to serve, and I look forward to the work ahead. So thank you, and back to you, David.
Thank you, Verna. We have reached the end of our agenda. I declare the business meeting adjourned. Thank you all for joining us, and please be safe and well.
Together, we do amazing things every day.